So it's really a great honor to be here again for the second annual Cancer Survivorship 101. And I am likewise a big fan of Jay's for putting this together and for having the absolute dedication, mission, drive, et cetera, to make sure that cancer survivorship is on the radar of medical providers, patients, policymakers, and make us researchers think about cancer survivorship in a different way. So thank you, Jay. So I am a general internist at the Brigham and Women's Hospital, and I'm also a cancer survivorship provider at the Dana-Farber Cancer Institute. So I bring sort of a kind of a two-sided perspective to this. And so the goal of my talk today is to help you understand the recommendations for clinical care after cancer treatment is completed, gain tools to help navigate the complexities of clinical care after cancer, and prepare your own survivorship care plan and next steps. So let's begin with understanding the recommendations for clinical care after cancer treatment. What you often hear about are cancer recurrence. And you go see your oncologist, and your oncologist focuses on cancer recurrence. You have your lab tests, you have your CAT scans. Your oncologist says, hopefully, you're all good. And you think, I'm getting great survivorship care. Well, that is just a piece of cancer survivorship care. So we need to make sure that the oncologist or the primary care provider or whoever is following you after cancer really does focus on your risk of recurrences, what will make your cancer potentially come back, and what are the ways that you can prevent your cancer from coming back? What tests do you need to have in order to detect recurrences? But there are other components of cancer survivorship care. We need to focus on physical effects of cancer and its treatment. So many cancer treatments will lead to a lot of physical effects. So one, of course, being surgery and the complications that can arise after surgery. Then there's radiation therapy and the numerous effects that patients may have after receiving radiation therapy. And of course, chemotherapy that can affect your heart, your lungs, your nerves. And so it's important then, as you're getting your cancer survivorship care, that you and your provider address what are some of the physical effects that you are having, what are you at risk for, and what are the ways that you can prevent or treat the potential physical effects that you're dealing with. The other piece of cancer survivorship care is attention to psychosocial issues that may happen as a result of cancer. So in the psychosocial domain, fear of recurrence is the most prevalent issue that survivors face. And so it's important to put that into perspective and understand that fear of recurrence is real. It is there for many cancer survivors. And so it's important to work with your providers to help you understand what is your risk of a recurrence and put that into perspective and be able to recognize the signs and symptoms of a recurrence and know how to balance being fearful and cautious enough, but not to the point where it's affecting your quality of life. What are the other aspects of psychosocial care? Well, there's the interpersonal relationships. Sort of a question that, never gets raised, and research has shown this, is that while so many cancer treatments can affect your sexual function, nobody talks about sexual function. Nobody talks about the effect, except Dr. Dizan over there, who will talk about it. But traditionally speaking, it's not addressed by the primary care provider, it's not addressed by your oncology provider, and it's not brought up by the patients because you don't want to bother the doctor with that. And the doctor probably doesn't want you to ask those questions because the doctor has no idea what to do with that. So that's something else that is really, really critical. The other piece of the psychosocial effects is the effect that cancer has on your work, on your school. So studies have shown that cancer survivorship leads to reduced hours, and oftentimes reduced hours at work years and years down the road. It could lead to people not going for a promotion. It can lead to people, making different employment choices. And then there are those, right, who stay on their jobs because they don't want to lose their health insurance. And we know that many cancer survivors face a lot of financial difficulties. A term in the research is known as financial toxicity, and it's now looked upon as we also need to look at, various toxicities of treatment, but we also need to address financial toxicity. So then the other under-recognized piece of cancer survivorship is that you may have other healthcare conditions. So it might be that before you were diagnosed with cancer, you might have had diabetes. And you're going through your cancer treatment, and your oncologist is focused directly on your cancer treatment, and sort of everybody forgets that your sugar is out of control because now we need to focus on your cancer. But studies have shown that when you have diabetes before your cancer diagnosis, you are at a much higher risk of having overall mortality and cancer-specific mortality. In other words, diabetes can increase your risk of dying. And so you can't just focus on your cancer treatment. You have to make sure that your diabetes is controlled. You have to make sure that your blood pressure is controlled, because many of these chemotherapy agents or radiation agents also have an effect on your heart. And so the last thing you need is to add diabetes and high cholesterol and high blood pressure on already an existing risk. So the role of primary care providers is really critical in this piece because you do need to focus on your overall health. And then lastly, health promotion. Cancer treatment is being given. And you need to figure out how to deal with it, of course. And oftentimes, cancer and its treatment, that's sort of out of your control in some ways. But what is in your control is what you do with your body. So focusing in on what can I do to improve my health? Can I walk? Can I do some exercise? Can I lift weights as I'm watching television? Can I stop smoking? Can I, do some meditation and relaxation therapy to help me through this process? So that is something that is really a critical piece of the cancer survivorship journey, and again, something that you and your providers really do need to address. And of course, really none of that happens in sort of in isolation of others. So really, individual factors are key pieces of this. So for some patients, depending on their age, depending on their cancer type, depending on their treatment, some of these pieces may need more focus than others. And so it's important that we individualize the kind of care and the attention that we get, but not neglect all of those 5 pieces of the cancer survivorship journey. And of course, the bottom you can see, depends on, sort of where you're getting cared for, the communication and decision-making that happens with your providers, how your care is coordinated, and of course, the patient and the caregiver experience. And so many of these aspects will be discussed today by the speakers, and so hopefully this will kind of set the stage for appreciating some of the advice that the speakers coming up will give you. So the next objective is to just provide you with some tools to help navigate the complexities of clinical care after cancer. So this was a slide to just remind me we're unfortunately unable to show a video. But this is a video that was developed by AHRQ, which is the Agency for Healthcare Research and Quality. And so if you go to their website, you can see a variety of different tools that they have put online, videos, that help you talk to your providers, prepare for your visits. You do need to strategize for how you're going to come and meet with your doctor and what information you need from them. Because as a physician, unfortunately, my time is limited. I would love to spend an hour with every patient, but my healthcare organization just doesn't really support that. So, we need to make sure that there are expectations that are reasonable. And so coming in with, clear questions and, kind of communicating with your physician, with your clinician, sort of what your major questions are, and understand that we may not be able to address every question at every visit, but knowing that dialogue and knowing that this person is available and that you may need a follow-up to address some of these other questions is important. But the important thing about this video that I can show is that this patient comes into a doctor's appointment and doesn't disclose early on some of their history or some of their risk factors. And this happens, I find, very often in the cancer survivorship space, where a patient might come to your office, especially as a primary care provider, and not, as a new patient, and not tell the doctor that you have cancer. So how do we address some of your cancer survivorship needs if we don't know that you have cancer? Or if you tell us at the very end, after we've had a long visit, and you say, oh, and by the way, doctor, I had Hodgkin lymphoma 20 years ago, and I had bone marrow transplant, and then all of a sudden, whoa, wait a minute, let's rewind and let me negate everything I just said to you, because now you just provided me with this really critical information. Another tool that is very helpful is something that's been developed by NCCS, which is the National Coalition for Cancer Survivorship. And so again, you can go on their website, and I'm happy to share these slides with you, and Jay can share them with everyone who attended. But they have developed this amazing toolbox, which you can access online. You can even get, I don't know if they still sell DVDs or CDs that you can put into your computer. But it's a whole program that focuses on empowering patients so that you can understand more about your healthcare, so that you can make informed decisions, and that you can communicate with your providers. Another terrific tool that was just revised and is, I downloaded it just to check it out and was really impressed, is an app that was developed by ASCO, which is the American Society of Clinical Oncology. That's sort of like the major organization for clinical and research cancer care. And the app is actually like, if there's one thing you can do today, I don't know how the Wi-Fi service is here, is just download the app and just play around with it. Those of you who have smartphones, of course. But it's really a terrific app to help you, juggle some of your appointments, understand some of your healthcare needs, even put in, I think there's an option to record the questions that you have for your physician. So this is really a terrific tool that I would encourage you. So what's the general information that you should have about your cancer and that your provider needs to know about your cancer? What was the cancer? I know this is kind of a crazy question, but oftentimes patients don't know exactly what cancer they had. They might say, I had lymphoma, but they don't know what kind of lymphoma they had. Or they might say, I had breast cancer, but they don't know that it was ductal carcinoma in situ, which is a precancerous malignancy. So it's important to really know what cancer you had, when was it diagnosed, and what was the location. So if that pertains, so did you have lymphoma in your chest? Did you have lymphoma in your abdomen? Breast cancer, was it the right side, the left side, et cetera? Other pieces are surgery. What treatment did you have? Did you have surgery? What surgery? Did you have chemotherapy? You don't need to know exactly the chemotherapy that you had. If you do, that's great, and that actually adds. But as a patient, I know that that's a challenge, and studies have shown that patients do not know what chemotherapy they have had. A critical piece is radiation. Did you have radiation? And if you had radiation, what part of your body was radiated? That is critical because radiation can lead to many effects down the road, starting around 10 years after diagnosis and may persist for many years after diagnosis. And so it's important. Was your chest wall radiated? Was your leg radiated? Was your thyroid? And it's because those are the things that you and your provider will need to know down the road. Immunotherapy, I think that's, a tough one at the moment, and most of us, most of the people who are having immunotherapy are still very actively followed by their oncologist. However, having said that, immunotherapy, which is sort of like the new drugs that are available in the oncology space, and there's like 1 million of them, they cause a lot of potential side effects. And so it's important that you're aware that you are on immunotherapy and tell your providers that you're on immunotherapy. So whether you're going to the emergency room, whether you're going to your primary care provider, whether you're seeing your dermatologist, because some of these side effects can be under-recognized, and that can cause a real problem. And then lastly, hormone therapy, and so that is typically used for breast cancer, for prostate cancer. Questions to ask. Am I still at risk for the cancer coming back? What can I do to lower the risk? What testing for cancer coming back do I need? Can my treatment lead to complications? And the complications, sort of in our jargon, medical providers, is called long-term and late effects. So long-term are those effects that you might have had, they might have started during treatment, but they can continue for years and years to come. Neuropathy is a prime example. And then there are the late effects, where basically you're done with treatment, years later you're doing fine, and all of a sudden you develop congestive heart failure. And lo and behold, it's due to the chemotherapy treatment that you had. So it's important to understand what complications am I at risk for and to what parts of my body. What testing is needed to see if I've developed complications? What can I do to reduce my risk of complication? What is the role of other medical conditions and lifestyle habits, as I mentioned? And then one of Jay's favorites is, who do I need to see and when, and how is my care coordinated? And that is really a critical piece. So lastly, just a few words about preparing your own survivorship care plan and next steps. And by this, I don't mean what's often termed in our world as a survivorship care plan, a piece of paper that you leave the office with, and that's supposed to just improve the full quality of your care because now you have a piece of paper. What I mean is actually the care plan, the plan. And the next steps. And so there are a couple of ways that you can do this. So I'm putting this here, this is Journey Forward, which is a tool that's available. Unfortunately, they're going away. So I think they're actually gonna be, so they will be closing shop on December 31st, 2019. So you can certainly access them before then. And what you do is you put in some of your information, some of the cancer treatment information that you had, and get a plan for them of what are the things that you're at risk for. Another source, which is not going away, is OncoLife. And again, the same thing here. The American Society of Clinical Oncology also has a way for you to develop a survivorship care plan. It's not automated, but it's something that you do with your provider, with your physician or nurse practitioner. And then something that has really been underutilized and understudied is, what effect does access to your clinical note have? So this is just an example in our system, which is called the Partners Patient Gateway, which is essentially you sign up and then you have access to your own medical records. And that is really another terrific tool so that you can understand what your providers are addressing, what information they have. And a study sort of not in the cancer space, but in the general space, found that patients who have access to their medical records actually understand their healthcare needs better, take their medications better, feel much more empowered. So, and then this then also forces us, the doctors, to write a better note. So lastly, local resources, and this is not an all-inclusive list. These are some of the centers that are available, and again, I'm happy to share these slides. And just to end, cancer survivorship care is complicated, and you can get lost along the way. So I really hope that what information I provided to you today can be helpful to you. Will it solve all of your problems? Absolutely not. But coming to events like this and learning and sharing and listening to what we present, and then also sharing your thoughts with us is really what's critical. Because changing doctors is really hard. Really hard. But if we empower the community, if we empower the patients, then I think we can bring about the change and make cancer survivorship care quality be much better. Thank you very much.